Have you ever felt a sudden, fleeting disorientation, or perhaps a momentary weakness that quickly passed? Many of us dismiss these brief incidents, thinking they're just a sign of aging or fatigue. But what if those fleeting moments were actually your body sending you a critical warning sign? Today, we're talking about something profoundly important for your health, especially as you get older: mini-strokes. Medically known as transient ischemic attacks, or TIAs, these events are far more common and dangerous than most people realize. Disturbingly, research reveals that up to 240,000 Americans experience these cryptic attacks yearly, often progressing into full strokes. Nearly 1 in 5 suspected cases later escalate into an actual stroke within just 90 days. That's a statistic we simply cannot ignore. What's even more concerning is that many traditional signs of stroke you might be aware of don't catch most cases of mini-strokes. Worryingly, studies demonstrate that the bulk of mini-strokes are now silent, with barely noticeable or even absent symptoms. In this video, we'll identify the unseen signs of a mini-stroke that most people ignore. Recognizing these overlooked stroke signals early could make all the difference in preventing permanent damage. Stay tuned to learn 8 warning signs of mini-strokes in the elderly you should never ignore. So, what exactly is a mini-stroke? A TIA is like a warning stroke. It occurs when blood flow to part of your brain is temporarily blocked, causing stroke-like symptoms. The key difference is that the blockage is brief, and the symptoms usually last only a few minutes, typically resolving within an hour without causing permanent brain damage. However, don't let the mini in mini-stroke fool you. While the symptoms are temporary, a TIA is a serious medical event. It's a powerful signal that you have a narrowed or blocked artery feeding your brain, and you're at high risk for a full-blown stroke. Think of it like a flickering check engine light in your car. It might go off, but you wouldn't ignore it, would you? Your body is giving you a chance to intervene before a major breakdown. Ignoring a TIA is like ignoring that warning light until your engine seizes up. Now let's dive into the 8 crucial warning signs. The first sign to watch for is sudden weakness or numbness, especially on one side of your body. This can affect your face, arm, or leg. You might notice one side of your face drooping, or one arm feeling unexpectedly heavy or weak. For example, you might be trying to hold a cup of coffee and suddenly your grip weakens, causing you to nearly drop it. Or perhaps while shaving, you notice one side of your face feels numb or less responsive. This unilateral weakness is a classic indicator. The second sign is sudden difficulty speaking or understanding speech. This can manifest as slurred words, difficulty finding the right words, or struggling to understand what others are saying. It's not just a senior moment of forgetfulness. Imagine you're in the middle of a conversation and suddenly your words come out jumbled, or you can't articulate what you want to say. Your family might notice your speech sounds different, or you seem confused by simple questions. Pay attention to these changes. Our third warning sign involves sudden vision changes. This could be a loss of vision in one eye, almost like a curtain coming down, or experiencing sudden double vision. These visual disturbances are often fleeting but significant. Picture yourself reading a book, and suddenly the words on one side of the page blur or disappear, or you see 2 of everything for a brief moment. If your vision abruptly changes, even for a short time, it's a red flag that needs immediate attention. The fourth sign is sudden dizziness, or a loss of balance and coordination. You might feel unexpectedly unsteady on your feet, stumble, or have trouble walking in a straight line. This isn't just a momentary dizzy spell. Consider if you're walking across a room and suddenly you feel profoundly off kilter, as if the world is spinning, making it hard to maintain your balance. You might reach out for support, feeling a sudden, inexplicable clumsiness. This could be a TIA. Our fifth crucial sign is a sudden, severe headache with no known cause. This isn't your typical tension headache. It's often described as the worst headache of your life and comes on abruptly without any prior explanation. If you experience an explosive headache that hits you out of nowhere, unlike any pain you felt before, it's a serious symptom. This kind of headache, especially when accompanied by other TIA signs, requires urgent medical evaluation. The sixth sign involves sudden confusion or trouble understanding. You might feel disoriented, unable to follow conversations, or find it hard to process simple instructions. This can be particularly alarming for loved ones. Imagine you're trying to perform a routine task like making a cup of tea, and suddenly you can't remember the steps, or you feel a profound sense of bewilderment. This sudden cognitive impairment, even if brief, is a critical symptom. Our seventh warning sign is sudden difficulty swallowing. This sensation can feel like food or liquids are getting stuck in your throat, or you might cough or choke more frequently than usual when eating or drinking. This is called dysphagia. If you notice an abrupt change in your ability to swallow, making meals or even taking sips of water challenging, don't dismiss it. This can be a subtle but serious indicator of a neurological event affecting your brain's control over these vital muscles. Finally, the eighth sign, and one of the most overlooked, is sudden, unexplained fatigue or general malaise. While fatigue is common, an acute, profound onset of exhaustion or a feeling of being off that doesn't resolve quickly can be a TIA symptom. You might wake up feeling utterly drained, or suddenly feel an overwhelming tiredness that makes even simple tasks seem impossible, accompanied by a general sense of unwellness. When combined with other subtle symptoms, this fatigue should raise a red flag. It's important to remember that TIAs are caused by a temporary disruption of blood flow to the brain, often due to a blood clot or narrowing of arteries. Risk factors include high blood pressure, high cholesterol, diabetes, smoking, and a history of heart disease. Understanding these risk factors is the first step towards prevention. Managing your blood pressure, maintaining healthy cholesterol levels, controlling diabetes, quitting smoking, and adopting a balanced diet are all critical steps. Regular physical activity is also a powerful preventative measure. Even moderate exercise can significantly reduce your risk of stroke by improving cardiovascular health and blood circulation. Aim for at least 30 minutes most days of the week. But what should you do if you suspect you or a loved one is experiencing a TIA? The most important thing is to seek immediate medical attention. Even if symptoms resolve quickly, it's still an emergency. Call 911 or your local emergency number right away. Don't wait to see if the symptoms get worse or come back. Time is brain, and prompt medical evaluation can help identify the cause and prevent a major stroke. During a medical evaluation, doctors will perform tests like brain imaging, such as an MRI, and carotid ultrasound to check for blockages in the arteries supplying blood to your brain. This helps pinpoint the exact problem. Treatment for TIA often involves medications to prevent blood clots, like aspirin or other antiplatelet drugs, or sometimes even surgery to clear blocked arteries. The goal is always to prevent a future, more damaging stroke. Remember the acronym FAST for recognizing a full stroke, but be aware that TIA symptoms can be more subtle. F for face drooping, A for arm weakness, S for speech difficulty, T for time to call 911. Apply this urgency to any suspected TIA. Early detection and intervention are truly life-saving. By understanding these 8 warning signs, you become an advocate for your own health and potentially for the health of those around you. Don't underestimate the power of knowing what to look for. Many people delay seeking care for TIAs because their symptoms disappear, mistakenly believing the danger has passed. This delay can have dire consequences, as it's the period right after a TIA when the risk of a full stroke is highest. So, take these warnings seriously. Your brain is your most vital organ, and protecting its health is paramount. Be proactive, stay informed, and don't hesitate to consult medical professionals if you have any concerns. We've covered a lot today, from understanding what mini-strokes are to recognizing their subtle yet critical warning signs. The knowledge you've gained can truly make a difference in preventing a life-altering event. Don't let these stealthy attacks go unnoticed. Be vigilant about your health and the health of your loved ones. Early recognition is not just about avoiding a major stroke. It's about preserving your quality of life. Make sure to watch until the end. And now you've caught all of these mini-stroke signs that you must recognize quickly. We've equipped you with the knowledge to recognize a stealthy transient ischemic attack event. This information can help save many lives, so please, go ahead and share it with your loved ones. You might be the reason someone gets the urgent care they need. Your health is in your hands. Stay informed. Don't miss out on more essential health information. Subscribe now for more informative content that empowers you to live a healthier, more vibrant life. We're here to help you navigate your health journey with confidence.